Over the years, numerous studies are helping us understand the biology of cancer cells. And as a result, doctors are able to improve diagnosis as well as treatment of cancers. In fact, there's a growing number of cancer survivors around the world. But the pandemic has since impacted cancer care. Cancer patients are at increased risk of COVID-19. How can we best care for cancer patients during these trying times? I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. If you're about to begin cancer treatment, it's normal to feel worried and anxious with COVID-19 still looming. But knowing what to expect and preparing adequately for treatment can significantly reduce the risks and ultimately protect your health. Let's welcome our guest for today. With us is Dr. Buenaventura Ramos Jr. He's an oncologist and president of the Philippine Society of Medical Oncology. We're also joined by Dr. Jorge Ignacio. He's the chairman of UP PGH Cancer Institute. Thank you both for joining us here on the program. The pandemic has affected many people in many different ways, and cancer patients are a unique group who are at increased risk of severe illness from COVID-19. Dr. Bill, can you explain this to us?
Okay, the COVID-19 pandemic continues to have severe impact on many people, including patients with cancer. Some cancer patients might be at increased risk of serious COVID-19 infection because their immune systems can be weakened by cancer itself or its treatments. Most people treated with cancer in the past, however, especially if it was years ago, are likely to have normal immune function, but each person is different. So it is essential that all cancer patients and survivors, whether currently in treatment or not, talk with a doctor who understands their situation and medical history.
That's right. So having a history of cancer may make you more vulnerable to COVID-19. Dr. Ignacio, how has this impacted the day-to-day lives of cancer patients as well as survivors? What's the current situation now?
Yes, it has been such a way that the cancer patients actually had this fear. It's an inherent fear and it's real. It should be a sort of a warning for everyone to take care of themselves. Otherwise, we'll have more problems than we ever envisioned. But we are making ways to make it safe for patients to be able to consult their institutions, their doctors. So we are finding ways to make the services more accessible to all the cancer patients.
While the pandemic has made many cancer patients hesitant to seek medical care, we can't stress enough that treatment needs to continue. Dr. Bill, what are the types of treatment for cancers that must continue?
Cancer treatment involves the use of surgery, radiation, or medicines like chemotherapy, immunotherapy, targeted therapy, hormonal therapy, and other therapies to cure cancer, shrink a cancer, or stop the progression of cancer. Depending on your particular situation, you may receive one treatment or combination of these treatments. And of course, supportive care. We take care of your nutrition, your mental health, your psychological health, and even your spiritual health. This is called the holistic approach to cancer care, taking care of the whole person and not just the disease. All of these should continue because a delay would mean reduction in their probability of getting cured or progression of cancer.
This is why early detection is key. Dr. Ignacio, tell us, how does early diagnosis lead to a better outcome?
In cancer treatment, if you get the patients early on, like stage 0 to stage 1, there's the chance of cure. Like in breast cancer, if you get the patient to stage 1, the probability of living on 5 years is about 90%. So that's a lot of patients living beyond what is expected. If you get the patient at stage 2 to 3, then your probability goes down drastically to about 60 to 70%. So that's a big letdown in the patients. So if you get cancer, you get a symptom, the earlier that you consult, the better, because if you get them, then the cure will always be there.
Dr. Bill, what happens when a patient with cancer catches a virus or maybe bacteria?
People with cancer may have a higher risk of getting infection because of some changes in the immune system or the body's defense systems. People with cancer might be more likely to get infections because of the cancer itself or because of certain types of treatment like chemotherapy or radiation therapy or poor nutrition, because a lot of these patients may have decreased appetite.
And for the most part, the risk of infection during treatment is temporary and the immune system should be able to recover, but it's not always easy. Dr. Ignacio, what other factors make these patients more vulnerable to infection?
Yes, as Dr. Bill has said, these patients would have chemotherapy that will suppress the bone marrow production of white blood cells. Aside from that, these patients actually would have breaks in their skin or the mucosa or the linings of their mouth or the gastrointestinal tract, where the entry of bacteria will be easier. And when a patient's white blood cells or their defense system are already down, then they won't be able to fight off the infection as well.
Dr. Ignacio, gaano kayo importante ang nutrition ng isang pasyente, especially when they're undergoing cancer treatment?
The nutrition actually would help the patient to be able to cope with the side effects or the toxicities of the treatment, like the chemotherapy and also the radiotherapy. These patients actually would have some depletion of the vitamins also, so you have to really supply them well with the proper nutrients that they need. An intact immune system would depend on the good nutrition of patients, like a good dose of vitamin C, vitamin A, vitamin B, things like that. All the minerals that goes with it.
Ultimately, each type of cancer and treatment affects people in many different ways, but there are steps that you can take to prevent infection. We'll discuss these after a short break. Stay with us here on MedTalk Health Talk, your partner in healthcare. This is CNN Philippines. Welcome back to MedTalk Health Talk, where your healthcare comes first. I'm Dr. Freddy Gomez. More than a year into the pandemic, many healthcare facilities have found safe ways to provide cancer patients with the care they need, from practicing proper health standards to pre-scheduling outpatient admission, helping these patients better manage cancer amid the pandemic. Now, the Cancer Institute of the Philippine General Hospital adapted strategies at the beginning of the pandemic to keep those living with cancer safe and protected. Dr. Ignacio, can you tell us about some of these strategies?
Yes. Well, immediately when the lockdown started, we tried to isolate the cancer patients into our own building, because in PGH, we have our own building of the Cancer Institute. So what we did was to open the gate on one side, which will be the entrance and entry of all patients, so they won't have to loiter around the areas where they can get the COVID infections. And we provided them with all the services that they need inside. So we had the laboratories, satellite laboratory in there, even the social workers and the field health workers are in there. It became a one-stop shop place. And there's also, of course, we have a triaging area. There's a swabbing area in front of the institute. And of course, we have the barriers in place and proper ventilations for everyone. And all the employees are with proper protective equipment, donning all the protection. And we have sterilization areas for each patient and the caregivers. And the outpatient also are asked to have proper triaging, very strict protocol before they come to a face-to-face consultation. But
Okay.
if we can help it, we have the telemedicine also, so we can entertain our consultation. If it's not really needed to be a face-to-face consultation, they can actually opt to have a telemedicine consultation.
Okay, yes, that's very good that the patient still does have options such as telemedicine. So all of these contingency protocols are being done to ensure not just the spread of the virus, but to give the cancer patient a sense of safety whenever they go for treatment. I'll switch conversations a little bit to the rollout of the vaccines, because this is what brings hope that those living with cancer are protected from COVID-19 infection. And they fall under the A3 priority group, which is also the group with comorbidities and those who are at risk, increased risk of severe illness from COVID-19. Dr. Bill, let's review what are the comorbid conditions that fall under the A3 priority group for the benefit of our viewers.
So the A3 would include the cancer patients and the patients with other comorbidities like hypertension, asthma, heart disease, liver disease, or kidney disease.
Medical clearance in general is not required for them, except for cancer patients undergoing treatment. Dr. Bill, are cancer patients advised to take the COVID-19 vaccine?
So the evidence of the efficacy of the vaccine, of COVID vaccine among cancer patients is currently limited. However, the susceptibility of cancer patients to develop severe COVID-19 infection is still high. Thus, vaccination is actually recommended. Each cancer patient is encouraged to have an enlightened discussion with the doctor or the healthcare team to arrive at the shared decision and informed consent. The various COVID-19 vaccines available in the country are safe and efficacious. We just need to have the proper timing on when to give the vaccine. So just see your doctor so you can be evaluated and cleared.
And Dr. Bill, kasama rin ba sa A3 category those who've had previous cancers years ago, who are under remission, who haven't been taking any cancer treatments for several years? Kasama din ba sila sa A3 category?
Yes, kasama sila sa A3 category. So aside from medical certificate, sometimes we just give clearance to all these patients. But supposedly they should not be cleared unless they are actually ongoing chemotherapy. But if they're survivors already, they've been cancer patients for a long time and just taking some maintenance medicines or not even taking medicines anymore, they belong to the A3 category and they are on the priority list, or even just show a prescription to prove that they are cancer patients, and they should be vaccinated.
Okay, mabuti na maliwanag yon. Vaccines are safe and recommended for those living with cancer. Please get vaccinated as soon as you can. But if you're undergoing treatment, please don't forget to consult your doctor. But if you need to go to the hospital or step out of your home, there are some precautions that you can take to protect yourself. Dr. Ignacio, what are some of the steps cancer patients can take to stay healthy amid the pandemic?
Yes. First of all, you have to take care of your nutrition. You can never overemphasize the use of vitamin C right now. Of course, if you're taking vitamin C, might as well take the whole multivitamins itself. But you have a minimum of 1 gram of vitamin C and add zinc to it and folate, and you'll be okay. Go ahead and eat well. But there are now a lot of nutritional supplement in the available. It is made specifically to augment the nutrition of a lot of our cancer patients. And of course, do not forget, if you are able to do some exercises, still to go out of your way and do some exercises. If you can just walk around the house, for that matter, just keep on doing.
Two common cancers among Filipino women include cervical cancer as well as breast cancer. We'll discuss the two and why early detection matters. We want to be your partner for a lifetime of good health. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and this is Med Talk, Health Talk on CNN Philippines. Cervical cancer and breast cancer are two of some of the most common cancers among Filipinas. And while cervical cancer has a high mortality rate, it's now a vaccine-preventable disease. On the other hand, many women develop breast cancer. Dr. Bill, could you please explain to our viewers why they should be aware of cervical cancer?
The cervix connects the vagina to the upper part of the uterus, and the uterus is the part where the baby grows when a woman gets pregnant. And this cancer can affect the deeper tissues of their cervix, and it may spread to other parts of the body, often the lungs, the liver, bladder, vagina, and the rectum. Once it has spread, it may cause a lot of discomfort or even death. That's why it's important to be aware of this disease and how it can be prevented.
Now, is cervical cancer now considered a vaccine-preventable disease, Dr. Bill?
Yeah, various strain of what we call HPV or human papilloma virus. It's a sexually transmitted infection, play a role in causing most cervical cancer. When exposed to HPV, the body's immune system typically prevents the virus from harming. However, in a small percentage of people, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. So it's available now, the HPV vaccine, so you can reduce your risk by having the screening test so they can be detected early and receiving the vaccine. The HPV vaccine protects against certain types of HPV that most often cause cervical, vaginal, or vulvar cancers. And there are guidelines on when somebody can receive the vaccine, so get in touch with your gynecologist regarding this.
Now I'll shift the conversation to breast cancer now. Dr. Ignacio, can you explain to us why is breast cancer so prevalent now in our country?
We are looking at a very high statistics of breast cancer here. And aside from that, there's also a breast cancer gene mutation that has been identified, only seen among Filipinas.
Okay, very good. Now, Dr. Bill, how can breast cancer be detected early? What should our viewers know about early detection?
So early detection of breast cancer would involve the breast self-exam that should be done by the women. Usually we advise it monthly, at least 1 week after menstruation. And if you're menopausal already, then you may just schedule a certain day every month to examine your breasts. And then at starting age 40, you need to have your baseline mammogram, and depending on the result of that baseline mammogram, you may be advised like every year mammogram from here on.
Okay, it's good that you mentioned the mammogram, and they also use the ultrasound in coordination with this. How good is it in detecting early stages of breast cancer?
Usually what we do for screening is the mammogram. So it can really detect the early stages of cancer even before you palpate it. So it's beyond palpation. You may not be able to palpate the mass yet, but it can be detected by mammogram. Now, depending on the result of a mammogram, especially if you may have dense breasts, then the radiologist may require another test, which will be the breast ultrasound, and both can be used in order to determine your risk if they see a mass there or a certain abnormality there. Then together with the two tests, then they would come up with a staging or grading on whether the findings are most likely benign or suspicious or most likely malignant. And depending on that result, then you may have to do further tests like a biopsy.
Now, Dr. Ignacio, if you could give 3 important reminders to our viewers on how to live healthier and try and reduce the risk of cancer if it ever was possible, what would you advise our viewers?
First, don't smoke. Limit your alcohol and eat well and exercise.
Very good advice. And with that, I'd like to thank oncologist Dr. Buenaventura Ramos Jr. and Dr. Jorge Ignacio for guiding us today. We appreciate your insights very much. Choose well and be well. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.